Unicef conducts its health projects all around the world. Stefan PETERSON has been appointed Global Chief of Health at Unicef since April 2016. Stefan PETERSON was formerly a professor of global health in Sweden. As a health system researcher and medical doctor, he also did extensive fieldwork in Tanzania and Uganda and worked with organizations such as the World Health Organization, WHO. We will hear from Stefan PETERSON, Global Chief of Health at Unicef, on today's Heart to Heart. Children are the future of a country. They are the future of humanity. Joining us today is Dr. Stefan PETERSON, Global Chief of Health at Unicef, an organization that supports a wide range of programs for children's health. Thank you and welcome to Heart to Heart.
Fantastic to be here. Thank you.
Yes, thank you for joining us. I know that you are perhaps on a very busy schedule, but you've made it to our studio. This, I believe, is your second visit to Korea following your first visit 3 decades ago?
Correct. 1989 I was here.
Yes. So I want to ask you, how does it feel to be back and why did it take so long for you to return to Korea?
Well, it's great to be back. And in fact, it's a pleasure to be back. But it looks very different now, I must say. Because now there are skyscrapers everywhere and it looks like Manhattan where I live these days. But even in Manhattan, my favorite restaurant is called New Wonjo.
Korean.
Correct.
Korean restaurant. Then what's your favorite menu at that restaurant?
No, I like the Korean barbecue and particularly kimchi, of course.
Really? So you can have, you can handle spicy food?
Yes, I can.
Yes, Korean food, barbecue is delicious. Well, thanks for sharing that. Of course, Korea has gone through many, many changes. I can't imagine what it must have looked like 30 years ago, since I was a lot younger. Now, you have been Global Chief of Health at Unicef for 3 years. So how does it feel to look back at all the changes?
I think it's fantastic because we often compare to the beginning of the Millennium Development Goal era in 1990. And since then, we've reduced maternal mortality by 1/3 and child mortality by half. So that's really fantastic. We've never really lowered mortality so fast in the history of humanity.
So what might be a project that you worked on that remains most memorable to you? Or what do you feel most proud of, in regard to what you have accomplished in your role at Unicef?
I think one of the challenges now is that the remaining mortality, we see mortality which is more difficult to address, newborn mortality and quality of delivery care, for instance. So one incident that stands out is when we introduced care for small newborn babies in a hospital in the Uganda actually, where I lived for a long time. And people, both health workers and parents, were used to small babies just dying. But we were introducing this skin-to-skin care, kangaroo care, where you put the baby inside for the small newborn. And then one of the nurses had a newborn baby, and that baby survived thanks to this. And it really changed not just that baby and that nurse, but it changed the whole concept in health workers and in the community, because people realized that we can actually do something about this. And you know, hope is very infectious.
As you've just said, it's a sad reality to hear about how people were used to newborn babies just dying. But yes, I have heard amazing stories about how these things work. The mom and the baby just bonding as soon as the baby is born. So yes, there is hope.
Yes.
There is hope, definitely. What brings you to Korea this time around?
The UNICEF has been working with Korea for over 7 decades. And now we are here to discuss and celebrate our collaboration and see how we go forward together, particularly for girls now, and challenging the status quo if you will, going forward to making it a better future for girls around the world, and then to advance particular areas of collaboration like digital health, for instance, where
Yes.
Korea is a leader.
We'll be talking about digital health in just a while. So UNICEF is a global leader in child and adolescent-focused health. What would you say are the most urgent needs to be addressed concerning global health for children at this moment, right now?
I would like to say that we see different challenges depending on where you are. Because in many poor countries, we still have the mortality issue, increasingly dominated by newborn health and stillbirths, but also pneumonia, for instance. The biggest killer of children is still a neglected disease. We still lose 900,000 children due to simple pneumonia every year. And that is very unnecessary. Yet in other settings, we see adolescents, like in Korea, like in my native Sweden, they sit down on the sofa, they use their smartphone, they eat too much junk food, and they are subjected to those things. They don't do physical activity, so we see a lack of well-being. So we have two challenges here, the mortality challenge remaining in some countries, and then the well-being challenge in many other countries.
Yes, we'll touch upon well-being as well. So you were saying that there is a difference when it comes to health issues, issues in developed countries compared to developing countries. So how are these issues actually, I guess, affecting the lives of children, though? Can you give us a few more examples?
Now, I think in many poor countries, first is the challenge of survival, and then it's the challenge of development, early childhood development, having access to good school, good health care, good nutrition. And then in different social classes, maybe even in the same country, and definitely in middle-income countries and in rich countries, we see the aspect of lack of well-being. So the challenge of actually allowing children to develop their full potential. It's early childhood development, it's good schooling, it's good nutrition, but it's also the aspect of lack of well-being, how they can support each other at school, how do you talk to your friend?
Yes.
When we say, how are you? Do we really want an answer? Do we know how to listen?
Yes.
Do we know how to prevent bullying? Can we stop the junk food? So it's a complex world now, and some of these challenges exist at the same time in the same country, but affecting different children differently.
So whether you're a girl or a boy, health is not just about, as you said, surviving, but it's about well-being as well. So how is UNICEF positioning itself to tackle such issues?
Well, I think our collaboration with Korea for a long time has been about maternal and child survival. And increasingly we are moving on towards continuing that, doing that better, but then also seeing how can we make sure that children now have good nutrition, they don't eat junk food, they still have access to the good food, that you actually ensure physical activity, can you have a good environment so that children can play outside, can you walk to school, and how shall we handle bullying at school? And bullying was only at school when I was young, but now bullying is also on your mobile phone, isn't it?
There's cyberbullying.
So we are moving into those aspects, and we are trying to reach children where they are, at school, online, etc. So it's a complex world, and our scope of work is expanding.
Yes. Yeah, these are some things that a lot of moms and dads are extremely concerned about. So if you were to give us personal advice, how can you fight bullying? Simple advice that you can give to moms and dads out there?
Well, I think it's the school obviously has a big role to play about building an environment and a culture which actually stops this, picks it up. And I think many schools around the world are becoming better compared to when I was a child. But these are complex areas, so I'm afraid I will not offer the simple advice.
Now, UNICEF has long been a leader in designing and enhancing and scaling digital health interventions globally. So could you please take a moment to explain to us the term digital health? What does it signify?
I think it's actually about doing the things we've been doing with paper and pen all along, keeping track of children, Have your child been immunized? Are you coming back or not? But using the advances in technology to actually do some of these things more efficiently. Knowing whether you come back, how your child is doing, whether your child has had the immunizations, but also helping health workers do their work better and helping their supervisors supervise them better, ordering supplies, etc. So it's the same digital revolution that we have seen in the rest of our lives, but taking that into the health sector.
So UNICEF is well positioned to guide countries to use ICTs. This is to deliver the right to the health of all children and adolescents. So what is UNICEF's comparative advantage in so-called digital health?
I think UNICEF is present in virtually all countries around the world. And in many low-income countries, we have very many people on the ground who work with governments and who can advise governments and say, yes, there are many solutions out there, but these are the pros and cons with different solutions. So we advise governments, we work closely with governments in the how-to. I used to work for WHO.
Yes.
And at WHO, we sent out a normative guidance. This is 1, 2, 3. But at UNICEF, we are more on the how to apply that normative guidance. And secondly, we are also a multi-sectoral agency. So we work with the health sector, we work in nutrition, we work with schools, we work with water and sanitation. So we deal with all the necessary sectors, I would like to say. So in between there, I would say we have a comparative advantage to advise governments how to proceed.
Guiding each step that we could perhaps follow. Can you give some examples of ICT-based solutions or the so-called digitally enabled health systems to support the achievement of UNICEF's health objectives?
Let me give you 2 examples. One which we've been doing for a long time has been about ordering supplies. And we have done that using SMS technology in something called Rapid Pro, which many countries use and we love. Basically to order supplies and know where they are, etc. But a second example I want to give you is about actually being in touch with young people and not using them as passive recipients, but having a dialogue. So we have something we love called U-Report.
U-Report?
Yes. And it's about having young people sign up to actually be U-Reporters. And we have millions around the world.
So do they report on things?
We ask questions and they answer and they can report on things. So we recently asked young people how they would like their health care. And we had 1 million responses.
Wow, such as, can you give us some examples?
Well, people want accessible health care close to them. They want health workers who listen to them, who just don't preach to them.
Right.
So it's about treating young people as active partners and not just passive recipients. So we see that the digital technology can enable such things.
So when you collect these reports, what happens next? I mean, because you're receiving many of them from many reporters out there.
Well, first we're trying to take it. Initially we may set this up in a UNICEF office, but increasingly we try to transfer that to government because government is the service provider.
Yes.
But we see it's not just government, it's also civil society and it's also news media. Because, you know, sometimes you need to generate demand by actually taking this to the media, taking it to the politicians, and then obviously taking it to government as a service provider.
All right, today I am joined with Stefan PETERSON, the Global Chief of Health at UNICEF, and here is footage of his wide range of activities for you all to enjoy. Every 5 seconds, a child dies somewhere in the world. UNICEF's work in health involves providing a high-quality medical service all around the world, including places where it is difficult to access.
From a UNICEF perspective, we think it's better actually to tackle the causes and the causes of the causes than waiting for the disease. So if you try to go to the root and the root of the roots, we sort of come to this idea about food system, where's the food system, and what's the physical environment, what's the urban planning. Is this good for health or not? What's the social environment? And what is it we can do at that level to make people healthy and not fall ill.
UNICEF is committed to helping people with a weak immune system, such as pregnant women and newborn babies, as well as children. It helps children and adolescents to grow into healthy adults. It also strives to solve health issues in crisis situations, such as natural disasters. Stefan PETERSON directs UNICEF's health policies. Our wish is to see his move, born of humanitarian love, make the world a healthier place to live. Dr. Peterson, you recently met with Korea's First Lady on the sidelines of the, is it UNGA, or the UN General Assembly?
Correct.
On missing the billion universal health coverage, and presented a proposal on the upscale of digital health platforms for more effective health systems. So could you tell us more about this initiative?
In Mozambique, we have worked with the government actually to help community health workers in the village do their work better. So they now have a smartphone when they see your child. And actually that helps them to guide the questions they should ask and put the right diagnosis. So it's a job aid, but it also orders new supplies, and it sends a report to the manager and the supervisor of what you have done, and it even helps train the health worker. So we see it as a very versatile tool for community health workers to do their job better and for their supervisors. So that is what it's about.
So how many, how many upscale application users are there at the moment?
Well, in Mozambique, there are 5,000 community health workers, and currently 1/3 of them use this, and it's connected to a national system. And now, with funding from the World Bank, we are actually expanding this to national scale in Mozambique, and we should reach there by 2022.
Yes. So if you could perhaps elaborate on how the program is run, perhaps you can give us more examples, and how do you provide support for the application?
Well, obviously it's about writing an application and getting it done. It's sorting out the hardware. But foremost, it's about training local people to be able to manage the system and set it up, because it's not a UNICEF system. It should belong to the Mozambican government and be able to run with Mozambican private sector and Mozambique's government. So our role is to support and build a national system together with partners, of course.
You're planning to expand the program scale by 2022?
Correct.
Yes. What kinds of problems can we solve by, I guess, inviting more countries to use the application?
Now, what we see is that we find it very successful in the case of Mozambique. So we think this is the way to go for many countries to make their systems more efficient and effective in tracing people who get lost, where children don't come back for immunization, for instance, knowing who is who. It's about enabling supervisors to know what is it you should be training on, what are your normal mistakes in your work, so it's individualized training. It's about ordering supplies, etc. So we see digital transformation of the health sector is really the way to be going forward.
So it's not just about inviting, developing countries, but it's all about developed and developing countries.
Totally.
All countries.
But I think the challenge for a country like my own, Sweden, which started early with digital health, was that we had so many homemade solutions in different provinces of Sweden that don't speak to each other. So the opportunity now for countries that are starting later is to actually have one national system, public and private, that talks to each other.
So I think it'll be very, very helpful. I think people nowadays, I guess as a result of social media, maybe that's where it all started. People are gathering to, communicate with one another as a group.
Yeah.
Perhaps this is something.
No, I think that's a powerful analogy. The communication is two-way, I think.
Yes.
One is to send a reminder. That's how I remember to take my children to the dentist, for instance. I get an SMS. But it's also about generating demand and drawing accountability, if you will. Because if we can find mechanisms now to ask questions, how happy are you with your health services?
Yes.
And so on, we can actually empower the users as well.
Now, the UN resolution on universal health coverage, UHC, was adopted in September of this year. This was where Unicef, together with other sister UN agencies and other development partners, reaffirmed commitments to taking leading roles to the challenges of implementing the UHC. So could you tell us about the significance and the meaning of UHC?
Well, I think universal health coverage, it's about people having access to health services and being able to afford them. And the significance of this was that it was actually heads of state who adopted this, who stood up. Presidents and prime ministers said, yes, my country, we promise to develop UHC for our citizens, universal health coverage. And I think that is the powerful thing. And that's where we as UNICEF can step in and say, well, Madam President, since you promised to actually deliver universal health coverage for your citizens, how can we assist you?
So simply put, if you were to be the provider, so you provide a system to each and every government, then it is up to the country, because each country has different settings. Do they implement the program, the application, depending on their own settings, or how does this work?
No, I think when we set this out, we plan with the government, we plan with private sector partners and saying, what is it that suits your context? So it is a customized system that the government will take over and run with. And obviously, we only do open source software, so the government is free to adapt and modify it. So there is no one size fits the whole world, no.
So it's different depending on each
It needs
government.
to be customized and contextualized, yes.
I see. Well, when it comes to, I guess, health aid and everything that is health related, it all boils down to more resources for UNICEF's health interventions and support. So what would UNICEF's pitch be to the Korean government of increasing, I guess, increased funding?
Let me have three things then.
Yes.
Because we are always, and since a long time, working with the Korean government now on maternal and child survival. So we want to continue to do that. But secondly, we want to do it smarter and better. That's why we are discussing digital health now and actually drawing on Korea's leadership and expertise in this field, but also reaching vulnerable groups like the disabled. I've been very impressed with how adapted your city is for the disabled and taking such initiatives and the gender aspect. But thirdly, it's about new areas as well that we want to develop for adolescent well-being and mental health, for instance. How you eat well, how you move well, how you can actually do peer-to-peer support and promote mental health. So a threefold pitch. Continue with the same, do it smarter and better, and develop new areas.
And that's what you're also focusing on at the moment. Now, not only are you the chief of health at UNICEF, you're a medical doctor with degrees in medicine, public health, and a PhD in international pediatrics. So what do you hope to accomplish in the future? What's next for you?
Thank you. I have many titles, but the title I'm most proud of you didn't mention. It's called Daddy.
Oh.
So I'm a father of 4 children, and what I hope for is that children around the world would have the same opportunity like my children to survive, but also to develop to their full potential. And that is the vision that drives me, and I know it drives many people in Korea, in public and private sector, and many citizens. So that's my vision, and I hope it's our vision to actually deliver on.
Yes, a message of hope. And finally, before we let you go, I would like to ask a personal question. So outside of your professional work, what is your biggest interest?
I like growing trees.
Growing trees?
It's sort of like growing children, if you will. You need to look long term, and it also has a bearing on the future, and I think about the survival. These days, increasingly with the climate change and climate catastrophe, we all need to plant trees. But planting something and seeing it grow, it's really something for the future. So I can recommend it to everyone.
Ah, okay. How many trees do you plant? How often do you plant? And where do you plant these trees?
Well, frankly, I'm from a farm in Sweden. So we plant, when you cut trees, you need to plant trees to replace them. The thing is, it takes 80 years for a tree to grow old in Sweden. So you plant not for yourself, you plant for the grandchildren. And that, I think that is a beautiful parable about life and the future as well. We need to plan long term, we need to do something now, but we need to plan for the future.
Yes, trees and children, something we can help grow, grow healthy. Thank you very much. I love how you said that your favorite title is Daddy. Thank you so much for your time once again. 감사합니다.
Thank you.
Without children, there's no future for humanity. And just as Dr. Peterson has mentioned, we should not forget that we can secure our future, secure humanity, only if we regard all children around the world as children of our own. Thanks for watching today. I'll see you again next time.